So we've been talking a lot about submental fullness or double chin, heaviness under the neck that is fat deep to the platysma muscle and makes it so that liposuction won't make it get better. I found this illustration, which I think does a nice job showing what I'm talking about, also by Dr. O'Daniel in an article he published. Now, this is an example of what can happen with aging. In youth, this muscle, the digastric muscle, is up here. The platysma muscle, which is the superficial banding muscle, is like that. Little bit of fat between, but in general, still has a nice sharp necking. And you can see here how over time and with age, this platysma muscle starts to droop and additional fat starts to accumulate underneath the platysma muscle. And you can see how at this point, that nice L angle becomes more of a triangle. And you can see over longer periods of time, this platysma muscle right here continues to weaken and have laxity and droop as it's pushed by fat. And sometimes this here is illustrating the submandibular gland that also starts to drop down below the jaw and create fullness in the neck. And at this point, there's no more 90-degree angle. It's just a straight up diagonal line. And so these are cases where a deep plane neck lift that actually addresses the fat that's deep, the submandibular gland, and these muscles, that's really the only thing that's going to help get the patient back to having some definition along the jawline. Because just pulling on this loose skin here, it will probably tighten and smooth the skin, but a lot of that fullness is still going to be there. For patients who come to my office that have this kind of anatomy, either from age or sometimes young patients will have anatomy like this just because it's genetic. For those kind of patients who I can determine by physical examination, I recommend a deep plane neck lift to actually resuspend all of these structures of the neck.